again, and today I will be presenting another drug for depression, which is called Trintellix. So what is Trintellix? Trintellix also has a generic name called vortioxetine. It's a prescribed medication used in adults to treat a certain type of depression called major depression disorder. It was approved by the FDA in September 2013. So currently, Trintellix is only available as oral form with three different strengths: 5 mg, 10 mg, and a 20 mg tablet. So here are some common dosing of Trintellix for major depressive disorder. Initial dose is 5 to 10 mg once a day. The maximum dose is 20 mg per day. If, if the patient is receiving a higher dose, such as 50 mg or 20 mg per day, they need to be decreased to 10 mg per day for 1 week before discontinuation. And if you are switching from a MAO inhibitor, you must allow 14 days to elapse between discontinuing a MAO inhibitor and initiation of vortioxetine. So here are some patient counseling points of Trintellix. You can take it with or without food, and do not take two doses at the same time or extra doses. Avoid driving or doing other stuff that require your alertness because this medication may cause dizziness. That's why call your doctor if you experience any of these side effects, such as constipation, diarrhea, vomiting, or tightness in the chest. A severe problem called serotonin syndrome might happen. When this happens, call your doctor or get medical help right away if you have agitation, change in balance, confusion, abnormal heartbeat, or seizure. So how the Trintellix works? It works by inhibiting reuptake of serotonin. It also has agonist activity as the 5-HT1A receptor and antagonist activity at the 5-HT3 receptor. Additionally, vortioxetine is a weak antagonist at 5-HT7 and 5-HT1D receptor, as well as a partial agonist at 5-HT1B receptor. So Trintellix is associated with many major adverse reactions. For example, it can activate mania or hypomania. Trintellix may precipitate a mixed manic episode in patients with bipolar disorder. In fact, a mixed manic mood swings have been reported in the patients receiving vortioxetine who were also receiving maintenance medication for bipolar disorder. Trintellix may be associated with acute ankylosing glaucoma, including eye pain, change in vision, swelling, and redness. That's why Trintellix can also cause serotonin syndrome, and some signs and symptoms of serotonin syndrome including anxiety, agitation, confusion, muscle rigidity, and tachycardia. Another major adverse reaction of Trintellix is it can cause suicidal thinking and behavior. Trintellix is associated with an increased risk of suicidal thoughts and suicidal tendencies in pediatric and young adult patients aged from 18 to 24 years. That's why Trintellix is associated with either low rates Off-treatment emergent sexual dysfunction are incidents comparable to placebo in the few clinical trials available. And finally, Trintellix can cause withdrawal syndrome. Some signs and symptoms of withdrawal syndrome include dizziness, chills, shock-like sensation, fatigue, and tremor. Here are some minor side effects of Trintellix. This can cause nausea, vomiting, diarrhea, abnormal, abnormal dream, and dizziness. Here are some common monitoring parameters of Trintellix. As mentioned before, Trintellix can cause suicidal thoughts. Therefore, we must monitor patients for depression, suicidality, and psychosis. We also for, watch out for any unusual change in behavior, such as anxiety, agitation, panic attack, and irritability. Additionally, Trintellix can also cause serotonin syndrome. Therefore, we must watch for signs and symptoms of serotonin syndrome, such as confusion, delirium, muscle rigidity, abnormal heartbeat, or seizure. And finally, we also need to watch out for signs and symptoms of hyponatremia, such as headache, trouble focusing, seizure, weakness, or change in balance. If, so if you are allergic to vortioxetine or any component of the formulation, don't use it. Likewise, if you are on lizolic or methylene blue, or you are using mild inhibitor or within 14 days of discontinuing of the mild inhibitor, Trintellix is contraindicated. As mentioned before, Trintellix can cause suicidal thinking and behavior. Therefore, we must instruct the patient family or caregiver to closely observe the patient and communicate conditions with healthcare provider, particularly during the first few months of the therapy. Likewise, the use of Trintellix is associated with an increased risk of bleeding, especially if used conco concomitantly with aspirin, NSAID, warfarin, and other anticoagulants. Trintellix can also cause central nervous system depression. In fact, patients must be cautious about performing tasks that require mental alertness, such as driving or operating machinery. And finally, bone fracture have been associated with antidepressant treatment, such as Trintellix. And here are some major drug-drug interaction of Trintellix. The first one is buspirone. Buspirone may enhance the serotonergic effects of Trintellix, and this could result in serotonin syndrome. This is a low risk, therefore we do need to monitor therapy. However, for, for, for inpatients with enoxaparin, the use of Trintellix may enhance the anticoagulant effects of enoxaparin. Therefore, we must discontinue Trintellix before initiating enoxaparin whenever possible. If concomitant administration is unavoidable, we should monitor closely for signs and symptoms of bleeding, and this is a moderate risk. We need to consider therapy modification. As mentioned before, if the patient is using linzolid, the use of Trintellix is contraindicated. in patients with the use of trintellix, and this is a high risk. Therefore, we must avoid this combination. And finally, Trintellix may enhance the serotonergic effect of MAO inhibitor, and this could result in serotonin syndrome. This is a high risk. Therefore, we must avoid this combination. And this concludes my presentation. Here are some of my reference. Thank you for listening.